Hello everybody, I'm Dr. Deepti Challa and I am a rheumatologist.
And I'm Dr. Shiva Challa, an orthopedic surgeon.
Together we are a couple of joints to answer all your joint related questions. So Shiva, we all are aware of menopause and how menopause causes issues with joint health, bone health, osteoporosis in women. But I feel in this particular territory, men are an ignored lot. So do men actually go through andropause and do men get osteoporosis?
Definitely, thankfully, men are an ignored lot in this particular problem because osteoporosis as such has become an epidemic now in India, unfortunately. But men, are they protected? Yes, in a way, because the hormone which actually as such the bone health good is testosterone. Surprisingly, beyond a point, testosterone itself gets converted into estrogen in men, which partly contributes to the bone health through the enzyme aromatase, which actually converts it into estrogen, surprisingly. And even in post-menopausal women, we do say that high testosterone levels are getting converted into estrogen, and that's how their bone health is sometimes maintained. But testosterone as such has a very important function as far as men's bone health is concerned, because it is an anabolic hormone, which is nothing but a growing or a building hormone, so to say in common terms. What exactly it does is it binds to osteoblasts, which actually help in bone formation or deposition of calcium and maintaining its architecture as such, and helps osteoblasts in maintaining the bone health and also building the strength in the bone, if you can say it in that way. And eventually when it gets converted into estrogen, it is doing the same job. So there are two pathways by which the bone health of men is actually well maintained. It's only until unless you're actually having a chronic disability, or say you're not using your limb, or you're bedridden for some reason and you have severe diabetes which is uncontrolled or anything like that, we call it disused osteopenia or osteoporosis, where generally patients with stroke or paralysis, or these people who are men who actually do not use their limb actually do end up with osteoporosis sometimes. But as such, your question makes sense because men are in a way protected from osteoporosis thanks to testosterone.
So men are lucky for being men as far as bone health is concerned, is what I gather.
I wouldn't get into that argument, but men are lucky in many aspects as such, because the hormonal imbalances that a woman has to though I would say they are the bigger gender and they are the more powerful gender and stronger gender, I would still say men are lucky health-wise, owing to the fact that their hormonal imbalances are not as severe as we see in men.
They don't fluctuate as much as a woman's hormone does.
They don't.
We don't see childbirth, we don't see pregnancy, we don't see menstrual cycles. So
I would still consider that as a privilege, but I wouldn't want that privilege myself being a man.